Thank you, Brett. Obesity in the United States is a major concern. According to the CDC, over 36% of adults in the U.S. are obese, and 17% of children aged 2 to 19 are obese. Often people will struggle to lose weight with special diets without success. For some people, weight loss surgery is the answer. Deborah Pinkerton is here to share with us the story of one patient who chose surgery to help her lose weight.
Thanks, Carrie. A York County woman knew she needed to lose weight, not just for herself, but for her son. Here's Rebecca Miller's journey. Simply picking up the mail is a breeze compared to what it was like 2 years ago for Rebecca Miller.
It was hard. I would be out of breath. I would just walk and then come back, and I would have to come in and I would have to sit down and I would have to catch my breath.
At the time, Rebecca weighed more than 600 pounds. Her problems with weight began as a child.
I've always had the weight issue going through school, you know, the whole way through elementary school up through high school. By the time I was a senior, I was probably about 325 pounds.
Rebecca gained 75 pounds when she was pregnant with her son. After that, her weight continued to increase. She realized something had to be done.
When I got to be 618 pounds and I could hardly walk anymore, I couldn't go to the grocery store without riding on one of the motorized scooters that they have. My biggest fear was that I wasn't going to be able to live another year. I was very lethargic. I had no energy to do anything. I actually developed sleep apnea.
So Rebecca enrolled in the surgical weight loss program at Hershey Medical Center. She met with psychologist Dr. Andrea Rigby.
She was candid about the fact that emotional overeating was one of her main issues, and she talked about the fact that since childhood she used food as a coping mechanism.
She taught me different strategies and how to cope when I feel like I need to go to food as a comfort, because it was acting as my friend.
What struck me about her was she was very determined to work on these behavioral issues. She was determined to start a program. She set goals for herself, life goals for herself, and she could see that by making these changes, her life would improve.
Rebecca's life was already improving. She lost 45 pounds before she met with bariatric surgeon Dr. Ann Rogers.
For patients at a really high BMI, I think the sleeve gastrectomy is the best first choice. You take out the larger, stretchy part of the stomach, and you leave behind a more narrow tube of stomach that really isn't stretchy. So patients know when they've taken maybe that one bite too much.
After surgery, Rebecca watched her weight drop.
And within the first month of surgery, I lost 42 pounds.
Nearly 2 years later, Rebecca continues to lose weight.
I have lost a total of 190 pounds. I feel great. My self-confidence boosted. I am able to go outside and do things and play with my son.
Rebecca says her weight loss has opened a lot of doors for her. She wants to lose another 100 pounds and return to the weight she had in high school. Carrie?
Thanks so much, Deborah. Well, Rebecca's surgeon, Dr. Ann Rogers, joins us now. And Dr. Rogers, as we saw, she really lost a good amount of weight already. It's fantastic for Rebecca. And she chose to have the sleeve gastrectomy, correct?
Correct.
Is this a more common procedure?
This is now by far the most common operation for weight in the world, and it has been since about 2013.
Oh my goodness. Who does qualify for the surgical weight loss?
Yeah, so we're running on guidelines that are a little old, but what those guidelines say is you should have a body mass index of at least 40 or 35 with some other severe weight-related medical problem.
Okay, many people aren't really sure how to calculate a BMI. How do you do that?
Thankfully, you don't have to do the calculation.
Okay, good.
It's a formula based on height and weight, and there are wheels or charts that can be used. We have a BMI calculator on our website, and that website information will be on the screen.
Yeah, it's right there for folks. They can go check it out. How about the insurance? I mean, do most plans cover the surgical weight loss?
I would say almost all traditional insurance plans do cover it. A few for smaller employers choose not to for reasons I don't understand, but most insurances do cover it.
And we were talking earlier, it's been quite a process to get the coverage, right? Did you say about 10 years?
The state of Pennsylvania finally agreed to cover weight loss surgery for state employees.
Okay.
And we were one of only a handful of states, I think 5 states, that still were not covering it for state employees. So when they turned that around in January, it was major cause for celebration.
Oh my gosh. Okay, well, Dr. Rogers, stay put because we will have more for you. We're going to chat with you in just a few minutes. But right now there is another chat going on as part of this special Good Day PA. ABC 27 and Hershey Medical Centers are hosting a web chat. Christina Butler is here now to share some of those viewer questions. Christina.
Hi, Carrie. Doctors are answering your questions right now at abc27.com/weight loss chat. Joining me now is the Penn State Surgical Weight Loss Program Manager, Cindy Hipser. Thanks for joining us. And we already have some questions. One of them is, once you have weight loss surgery, can you reverse it if there are complications?
Well, it would depend on your surgery. There are some cases where with severe complications they could look at reversing a gastric bypass. However, with a sleeve gastrectomy, we do remove part of the stomach and that can never be returned.
Okay, good information. Another question that we have is, I've thought about having the surgery, but if I can only eat small amounts of food, how do I know that I'm getting the right types of nutrients? And also with that, what types of foods can I expect to eat?
So you can expect to eat, once the surgery is over, almost everything you had before, just at a small portion, and hopefully a whole lot healthier. We work with our dietitians on a one-to-one basis and in groups to teach you what the right nutritious foods are, what you're going to need to do after surgery, what kind of vitamins you'll need, protein shakes, those kind of things, to assure that you continue to have the right nutrients too.
Okay, and is there also a list of foods that you should avoid?
There are some breads sometimes for certain people, rices, things that could stick, and they will go over all of those both before surgery and after surgery with you.
Okay, great. Thanks so much, Cindy. And again, doctors right now are answering your questions. You can log on, abc27.com/weight loss chat. We'll be back in just a bit. For now, though, Carrie, we will send it back to you.
All right, thank you, Christina. And we will be back with you, Christina, in just a bit. But coming up next, for Trina Stokes, teaching became more challenging as she gained weight. Her story is coming up next on this special Good Day PA on ABC 27. Stay with us. And welcome back to this special Good Day PA. Deborah Pinkerton is back to share another story with us. Deborah.
Thanks, Carrie. A Franklin County woman teaches children. Her weight became an obstacle. Here's Trina Stokes' journey. This is a typical afternoon for Trina Stokes, grading papers. She teaches ELA at Lurgan Elementary School in Chambersburg.
I love to teach sitting on the floor with kids, whether that's the whole class sitting around the perimeter of a rug, or it's a small group sitting in a circle.
A way of teaching that Trina wasn't able to do for years.
And it was very challenging. As my weight got higher and higher, I would find myself just staying in one place, and the kids would always have to come to me instead of moving around the room.
Trina struggled with her weight since she was a child.
The first time I remember being aware that I was different was around 3rd grade. Someone had made a comment to me, and it was the first time that I realized I don't look like all the other girls in my classroom.
Trina watched her weight continue to increase as she got older.
In college, continued to gain weight slowly but steadily. And that's when I first remember dieting, trying to cut back on my calories, eating healthy.
Trina tried her best not to gain weight when she married George during college.
When I got married, I was about 165 to 170.
I had never thought about weight. It wasn't a big deal to me. I was never a skinny guy, so it really wasn't something I looked for.
I had our first child about 6 months after I graduated from college. And with each child, I gained more weight than I should have.
I was afraid for her health, and we had had the conversation many a time. You know, she was a young woman, you know, late 20s, early 30s, and you're 300 pounds. And I wanted her to be around 25 years from now.
Trina knew something had to be done when she took her kids to an amusement park. At the time, she weighed 340 pounds.
I went to get on a ride with my kids, and they couldn't get the safety bar closed. I needed help to just do the simple tasks so everyone could enjoy this ride.
So Trina enrolled in the surgical weight loss program at Hershey Medical Center.
There was the realization that I had an addiction, just like other people have addictions, just mine was food, and it's not something you can totally get rid of in your life. You can't just stop eating. And I needed to have some tools to manage that successfully and in a healthy way.
Clinical dietitians worked with Trina.
The big thing with our patients here at the Surgical Weight Loss Center is really trying to work on the healthy lifestyle changes as far as eating and exercise, and trying to get them to make changes before, so then after surgery they can have that part of their lifestyle and have a good successful journey with that.
Trina lost 40 pounds before surgery. She chose to have the sleeve gastrectomy,
which is an operation where you actually completely remove the outer stretchy part of the stomach. And we're able to actually remove that through one of our small port incisions. And then the patient is left with a narrow tube of stomach that is not at all stretchy. So it's hard to just keep eating and eating. Eventually you'll get to the point where you know, okay, I've taken one bite too much.
I began losing weight right away. The most weight came off within the first year and a half.
It was just amazing. Week after week, she would lose 8 pounds or 7 pounds or 6, you know, and it just kept going and going and going.
I'm between 155 and 160 pounds.
I'm happy for her, and she can do things. She's not tired. She's got energy.
I'm proud of where I am. I've got my 5-year anniversary coming up this spring, and I've been able to keep the weight off. I'm a different person than I was when I started this journey.
Trina had high cholesterol and sleep apnea. Now she doesn't have any problems. Stay with us. We'll be right back.
Welcome back. Dr. Ann Rogers, the program director of the Penn State Surgical Weight Loss Program, is back with us again. So I just want to ask you this. We've heard that you'll have the surgical procedure to lose weight, but is there benefit in other health issues that people are having?
Oh, absolutely.
Okay.
Like was just shown on Trina's story. Her sleep apnea was gone, the cholesterol was gone. A lot of patients see improvement of their diabetes. Some people are cured of diabetes. It's amazing. And really, I think the main point of it is to clear up medical problems. The weight loss is great also, but that shouldn't be the primary thing.
And how does it do that? Is it because it's dropping the weight? What gives that health change?
Some of it has to do with hormonal changes. I think a lot of it has to do with hormonal changes. And of course, then there's the added weight loss, which contributes.
Right.
Yeah.
So for viewers at home who are listening to this and they're interested, what should they do right now?
It's easy enough to see one of our seminars. We have 2 live seminars every month where patients can come in and talk to the surgeon and learn about the different kinds of operations. We also have an online seminar that people can view at any time, and that's available on our website.
How valuable are those seminars for folks who are thinking about this? Would you suggest that that's a really good idea?
Oh, absolutely. It's really great to be in a room full of 60 patients, all of whom have the same fears and struggles that you've had, and to hear other people's questions.
And I bet you hear this a lot. Patients asking you, how much weight am I going to lose and how long is this going to take?
Yeah, everybody wants it to be gone in a month. You know, Rome wasn't built in a day, and the weight didn't go on overnight. So I would say most people can expect to lose approximately 1/3 of their weight. And that's going to happen in 1 to 2 years, depending on things like their metabolic rate, how well they're eating, are they exercising, things
and
like that.
Are these the types of things that they will learn when they clue and to go to the seminars.
This is a big part of our program.
And you say that they're how many times a week for folks?
If patients have an insurance that requires 6 months, they come once a month.
Okay.
If they have a 3-month insurance, they come twice a month.
All right. And I do want to tie in the 2 patients that you had here. Those stories, I'm sure, resonate with people. What do you want folks to know at home about what they might have gotten from the patient stories?
Yeah, I think these are typical results. You know, if you see an advertisement in a magazine that says these results not typical, that's because it's not. But these are fairly typical results, and I think people need to know this has gotten to be very safe surgery. A lot of people are afraid because people tell horror stories. This is the safest possible surgery you can have.
Thank you so much, Dr. Rogers. We appreciate it. I'm sure the viewers appreciate it. But up next on Good Day PA, we still have to check in with the live ABC 27 weight loss web chat, and we'll share more of your questions. Go to abc27.com/weight loss chat to submit your question, and we will be right back. Welcome back. Today's ABC 27 weight loss chat continues. Hey, Christina, is it busy over there?
Hi, Carrie. It is busy over here. We've had about 20 questions come in so far, and medical experts are busy answering those questions for you right now. The web chat continues until 1:30 today. We are joined again now by Cindy Hipser. She's the program manager for the Penn State Surgical Weight Loss Center. And some of the questions that we've had come in have to do with patients who have already had the surgery, so they're asking these questions at all. One of those, I had gastric bypass surgery over 7 years ago, and I've regained some of the weight I lost. They want to know, is it possible to have a second weight loss surgery?
Well, Christina, it really depends. If you didn't have the surgery with us, we'd have to get your medical notes, see what kind of surgery you had. Sometimes we bring people back to our dietitians to see how they're doing, get a check-in, maybe a kickstart back to the right eating habits. And then if those things don't work, we can do testing to see if your pouch has stretched or how your sleeve is functioning. And then there are some options which would have to then be discussed with the surgeon and are very individualized depending on those testings and the individual person's previous surgeries.
Okay, thanks a lot. And our next question, I'm 38 years old and I weigh over 450 pounds. If I have weight loss surgery, will I need to get plastic surgery to remove excess skin?
Again, dependent on the patient. A majority of our patients do not, but it does depend on the elasticity of your skin, your weight history, where you were carrying your weight. Those kind of things all play into it. A lot of people can't always get insurance to cover it because they need to show that it's medically necessary as well. But it really does depend on the person, and we work with people about 2 years out once they're stable to see if they need it or not.
Okay, thank you very much. Carrie, back to you.
Thanks, Christina. I also want to thank the team at Hershey Medical Center for today's special program, and of course both Rebecca and Trina for sharing their journeys with us. The live conversation continues online at abc27.com/weight loss chat until 1:30 this afternoon, so you still have time to get your questions answered. If you think you qualify for the surgery, you can call 717-531-7260 or go to their website at hmc.pennsstatehealth.org/SWL to register for one of the free upcoming seminars. And 1 week from today, join us for another special Good Day PA. Specialists from the heart team at the Medical Center will be here to talk about heart risks. We thank you for joining us today. Have a good day, PA. Make it a good day, PA.